Welcome to the sample application for the health insurance marketplace on HealthCare.gov. Here, individuals and families can explore health coverage options and opportunities to get lower costs on monthly premiums. Individuals can submit applications starting October 1st when open enrollment begins. The application features dynamic messaging to answer consumer questions, to guide them through the process, and to encourage them to apply. This online dynamic tool will enable applicants to complete one application for enrollment in a qualified private health plan, the Children's Health Insurance Program, and Medicaid, and determine if you're eligible for lower costs on your monthly premiums. With integrated electronic verification, applicants can get health coverage and be matched with programs to help make that coverage more affordable. To demonstrate, let's look at the application process for a fictional single man from Arizona, William Doe, who is looking for health coverage just for himself. William will fill out the application online to apply for coverage. Before beginning the online application, William will create a user account. Then, from his account, he will access the application. The privacy and use of your information page lets William know how the information he enters will be used, and that data from other sources will be accessed to verify his information. Integrated systems will check his eligibility by retrieving information from other federal agencies to verify responses and provide real-time answers. Personal health data is not stored. On this contact information page, William answers a few questions about his home and mailing address, his contact phone numbers, the language he prefers to speak and read, and how he wants to be contacted by the marketplace. This information is not shared with any external party. William has the option of naming someone as his trusted representative. This person would have permission to talk to the marketplace about William's application and sign William's application on his behalf. William declines this option. William is only interested in getting health coverage through the marketplace for himself. So on the "Who are you applying for health coverage for?" question, he selects William Doe. William checks yes to see if he is eligible for help paying for health coverage. William isn't adding any family members to his application. If he changes his mind, he can add additional family or household by clicking Add Another Person. In the next section, Family and Household, applicants can apply to get help with health insurance costs. In the William Doe Personal Information screen, William enters his personal information. Then he completes a series of questions about his household and how he files taxes. Here, William has the option of providing his race and ethnicity. William needs to answer a few additional questions that could determine whether or not he qualifies for additional assistance or certain protections. Here on the Family and Household Summary screen, William has a chance to review his answers and make any changes. Eligibility for financial assistance or for Medicaid or CHIP is based on income and household size. On the Income screen, William finds out what documents he needs to answer the next set of questions about his income. Income information can be complex. This part of the marketplace application incorporates electronic verification to help applicants easily answer these questions as accurately as possible. When federal income tax data is available for a household member, and the confirmed income amount is high enough so that no family members applying for health coverage would be eligible for Medicaid or CHIP, this section is shortened to two simple questions. William enters his expected annual income of $40,150 in 2014. We ask one question about William's monthly income to see if he is eligible for Medicaid in the current month. Here, we use the figure $1,250 because this amount would make William eligible for Medicaid. William's monthly income will be more than $1,250 per month, so he is not eligible for Medicaid. Once we know household size and income, the system can determine which affordability program each applicant may qualify for. To see if William is eligible for lower costs on his monthly health plan premiums, we'll need to know whether William gets or could get affordable health coverage through his job. To determine this, we ask some questions about William's employer. In this section, William will be able to review everything he's entered and have a final chance to go back and make changes. On the Review Application page, William can review and print out all the information for his records. William then reads and agrees to a few additional statements. To get his eligibility results, when he's ready, William must review and agree to the list of statements on the Sign and Submit page. The statements are based on programs he may be eligible for. He can then sign his application electronically and officially submit it to the marketplace. On the application results page, William gets a list of programs for which he qualifies, and we let him know the next steps. Applicants can print the results page and have their eligibility determination saved to their electronic account. In this example, William qualifies for a tax credit, a way to get lower costs on his monthly health plan premiums. By clicking on links on this page, William can also get more information such as how his eligibilities were determined and how to file an appeal. That's a quick look at the application process. With the application process complete, William can now enroll in a Marketplace health plan and apply his tax credit right away.